Okay, now we'll proceed further and study the screening program. Now, imagine a situation that we have to, on my birthday, or Mahatma Gandhi's birthday, let us say, why my birthday, we have decided that we will do some screening program. Your batch has decided that we will do some screening program. Why not? If we are health providers, let us do this type of job. What all we will do? We will select a place where we will go and do screening. We will arrange buses. We will go to that place, that village, and organize. Otherwise, when we will reach there, there will be nobody. So we will meet the leaders, the community leaders, the teachers, the Gurdwara, the Mandir people, the Sarpanch, another prominent leader. We are coming, doing this thing. We'll tell them, request them, select a site where we will do it. So we will do all these programs, and we will also organize ourselves. But then a question will come: what disease? What disease we want to screen? So that question is answered by what are the considerations or what are the factors which help us or which make us decide which disease to screen. Otherwise somebody will say, oh, I am suffering from this problem, so let us do survey of this screening, and somebody will say that my grandfather died of this disease, and so let us do this, because everybody will have its own interest. So we will not be able to come to a good conclusion. So these are the factors which the book has already given in a very nice way, 9-10 factors, which are very simple to remember. If you read it twice, there is no issue. You should do a disease which is a public health problem, which means the prevalence of that disease is high. Remember, the word here is prevalence and not incidence. It may not be correct to do a disease which has a high incidence but low prevalence. This NEET has not asked it, but yesterday I was studying. Then I found it can be a question. Disease, the treatment should be available. There should be a test which is available to detect that disease. There should be a benefit of doing screening. If there is no use of doing a screening, there is no benefit to the people, to society, to nation, to screen for that disease, then we are wasting our resources. So these type of 7-8 points are there. It should be cost effective. There should be latent period so that we can detect the disease early. So these type of points are there, which are not difficult to remember. But remember, these 9 or 8 points which is given in the book, you have to read twice, thrice, you have to remember them, help us to detect which disease to select for screening. And second aspect which the book says in detail, which test to select. Now let us say we have decided that we will do screening for anemia, we will do anemia, screening for anemia among the adolescent girls in a village which is our rural training center village. So we have decided the place, we have decided the population, we have decided the venue, and we have decided the disease. The disease is useful, it will help to treat anemia before they go into their motherhood. At the adolescent age, anemia is a problem, it is a high prevalence disease. We have got a test, the disease shows iceberg phenomena. So there is a latent phase before this thing. There is a treatment available, we can help them. So these are the factors. It satisfies most of the points of the disease. But which test? We can detect disease, anemia, by various tests. I can do a clinical examination, look for pallor in nails and tongue and conjunctiva to diagnose. I can do a hemoglobin by Sali method, or there are more sophisticated methods, or there is a paper test for hemoglobin. So which test to take? That test, which is the ideal test, depends upon 3 or 4 factors. Park has given 3. Let us take one more factor, 4 factors. First, the easier one we will do first is it should be acceptability. The test should be acceptable. And normally the test, remember, we are testing a apparently healthy population. If I am suffering from IHD or pain in the chest, I will be ready for passing a catheter into my coronary arteries also. But if I am not suffering from pain in the chest, I am not a case, then probably I will be very hesitant to give a blood for cholesterol also. So non-invasive test, the tests which are non-embarrassing. People may not be, people who are not suffering from a disease or symptomless may not be willing for examination for a peer examination because it's embarrassing test. So these type of tests should be acceptable in the situation. Normally non-invasive test and non-embarrassing tests are more acceptable. Secondly, the test should be cheap. I have discussed earlier that I cannot take a very sophisticated, costly test in my village for purposes of screening. The third point is the test should be repeatable, and there are 4 words with repeatable. It should be either repeatable or the synonyms are there. It should be reproducible, it should be precise, and one more word is there which you have to remember because these questions once they have asked. Remember, precision, repeatability, reliability and reproducibility are 4 synonym for the, which means that if we do the test again on the same person, a child has come to show anemia, we have found anemia by one test. Let us say we are doing Saliv's test. When the test is repeated on that child, it should also tell that he or she is anemic. If the next time the test says no, our hemoglobin now is 12 grams or 13 milligrams %, then the test is not reproducible or repeatable or precise. Why the test? Now in the park they have given in a great length discussed why a test may not be reproducible. What are the factors when we do repeat a test under the same circumstances but in a different frame of time? The frame of time can be immediately after. If I do your blood pressure and I take my blood pressure after my blood pressure and again after 5 minutes, the readings are different. So why this difference is there? This can be because of various factors which we have to study, generally understand. The one is that we are calling intra-observer. Intra-observer means you have done the Saliv's test. You are doing the Saliv's test again in a different time frame. But the difference is coming, though you are adopting the same method, same technique. This type of test may change. The readings may change, which is known as intra-observers. So this type of differences can be reduced by taking average or mean. If you do the test 3 times we are finding different readings. You are doing the test in the same way, using the same equipment, the same chemicals, in the same child. Then we can take the average. We should take the averages of the 3 readings. The second is inter-observers list. First test you have done, the second test I have done, the third test another student has done. And all 3 readings are different. Now, what do? This means we have to train them. This means somebody may be doing the test in a different way. And somebody may not be doing the Saliv's method. I am picking up air bubbles because I am not well trained. And somebody is not adding the correct amount of acid. So these type of things means that if we do training, accurate training, then the test will be results will be more reproducible. The third reason can be equipment is causing the defect. Equipment is at rest means a weighing machine is there. I take weight, then you take a weighing weight, and third person takes the weight. The machine its zero has moved. It is, So this means the machines, the equipment, the instruments can cause difference. So we have to standardize the instruments. We have to use the same instrument. We cannot use different type of blood pressure instrument. One we are using, some people are using mercury one, some people are using Android type. Understood? Some is using palpatory method, somebody is doing oscillatory method. So these type of, we have to standardize the procedures. And the last is that there is actually a change. That everything is okay. There is no intra, the equipments are same. The readings are actually changing in person. My blood pressure changes in the morning and evening. My BP, my temperature changes, is different in the morning, in the afternoon, and in the evening. So the thermometer is same, the readings are correct. So that can be divided into three. So basically you remember two at least. One is objective, there is objective change, and the second is the change can be subjective. You ask me, yes, the pain was less in the morning, now in the evening it is more, or it is more in the morning because of the cold factor, and same my arthritis pain becomes less in the afternoon because of various factors without treatment. I am not taking any treatment, but because the temperature is more during the cold temperature. And thirdly, it has given that regression to the mean. Don't go into details of regression to the mean. It is a statistical phenomena which occurs. Don't go at undergraduate level, but just remember the term that phenomena and readings regress to the mean. Just we at our level, we should not waste energies in regression to the mean. So now we have done three qualities, that is acceptability, repeatability, and cost effectiveness. Next time we will do the most important one, the validity. Thank you.